Thank you very much. I'm observing your figure 3 here on your chart, which really demonstrates very clearly the skyrocketing element of health care versus the other discretionary spendings and other mandatory programs, Social Security as well. You know, this is the biggest challenge, and that's why it's a great question. And number one, there just is no longer an effective market. The federal government has regulated health care basically out of existence. And what we need is a deregulated, competitive market. We need a situation where prices are actually posted. We need new competition, not more regulation. You know, the concept of certificate of need in terms of bringing in new hospital, new resources. And I know in our business, we serve many retailers. And there's a lot of competition in retailers, and competition generates lower prices and better products and better services. But I can't imagine for the life of me that Target could have, or a Walmart, or a particular retailer could have the monopoly to declare to their competition that the competitors have to go through a certificate of need to open up another retail store.
Would you repeal the certificate of need? A lot of that is done at the state level. Would you try to eliminate the certificate of need?
Yeah, this is just part of the total program. I mean, you have a layer of these issues that pile on. Any one of these in their own are not problematic, but when you have this total impact and all of these regulations come in, that's where you have the problem. The other area is in terms of having true buyers clubs. You also need to have health care that in a competitive market would have a guaranteed renewable, so you could carry that with you in the future. You could follow it from job to job to be portable. You move across state lines, that you could choose the particular benefits that you'd want and not have all the benefits mandated. If you did not need acupuncture care, you shouldn't have to, increase the cost for that. So here's my summary here. I think we need to remove the regulations that keep prices up and competition and innovation out. And a big part of that is tort reform that is just causing a tremendous crunch, and we know that that adds even more cost to the system. You know, the good initiative, and I've looked at many of these programs that are out there, and of course, because the problem is so tough, and I'm afraid we have too little leadership in Washington, D.C. to deal with this. I mean, this can has been kicked down the road year after year after year, and this is not a new problem. But I was particularly impressed with Ron Wyden, a very liberal senator from Oregon, teaming up with Paul Ryan in a bipartisan plan for health care reform. Here you have premium support aspects with competitive bidding. You have means testing. You have the Free Choice Act that Wyden put together. It protects those seniors that are already in the program, and it creates a whole new element so that your chart is not going off the top, but begins to reverse that and turn that down with free market opportunities in the system. But it's not just the program that you need to present. You need to have that bipartisanship. You need to get people together. It's just as important on how you do that to drive the health care costs down as the program that you present. And so I looked in this one case study with Senator Wyden and Paul Ryan as a very good step forward. Now, regrettably, Ron Wyden's party jumped all over him, all the Democrats and the liberals, and they said, hey, you're going to be taking away the arguments that we have here for the election. And what's the big idea of trying to come together to solve a problem? So I keep driving back on many of these costs, as complicated and as tough as they are. You need to send people to Washington, D.C. who put the problem ahead of themselves and their career and have had that kind of experience in problem solving. These are the areas that are going to be able to reverse that curve and be able to get the job done. Right now, we're in a crash and burn scenario, as we'd say in the Marine Corps. With the right leadership, we can change that flight pattern and get us back steady again.